So I'll quickly move to the next blood vessel issues in children, and this was the large atriovenous malformations. So anytime you hear atriovenous just simply means there's an abnormal connection between an artery and a vein. So an artery and a vein should connect, but it should be through those arterials and venules. Do you understand? So if you're having any abnormal connection between an artery and a vein, that's what they call an arteriovenous fistula. Okay, so if it occurs in children, it's actually a complex vascular anomaly. Do you understand? Can pose a lot of risks. So what is it? It's just an abnormal connection between arteries and veins. So normally arteries and veins should connect through what? The venules and arterioles that come together to form the capillary bed. But if there's any other connection out of this that is bypassing this normal way of connection, they have a lot of what? Issues. Okay, so high flow nature, so blood rushes directly from arteries to veins, so it can cause a whole lot of what? Instability, you know. Congenital origin, so most of them are present at birth and may enlarge as the baby is growing. Okay, so symptoms is what? Visible signs, so they're having red, pink, purple birth marks. All right, if you check the place, it's swollen, you know, it's warm. Okay, neurological issues, seizures, headaches, weakness, most of the times it occurs in the brain. Bleedings, it can rupture. Okay, the growth abnormalities, so the baby is affected, limbs may grow larger or longer due to increased blood flow, you know, all those things. Okay, abnormal connection between an artery and a vein. So associated syndromes, if you see it in a child, you might be suspecting things like the Combs syndrome, the Parkes-Weber syndrome, the Wyburn-Messin syndrome. We're not saying it's only these ones, but you mostly see it associated with these ones. Okay, mostly see it associated with these ones. So diagnosis: MRI or MRA, arteriograms, then genetic testings. Okay, treatments depending on the size, depending on where it is found. So if it is very small, you can just keep observing. Right, sometimes surgical removal, sometimes reconstructive surgeries. Okay, so that's what we got for this. Bye for now.